Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. We've got a very special guest today in Dr. Lauren Mitchell, where she's going to talk about the way healthcare should be. So make sure to stick with us through the whole show. She's got some great advice. Now, before we begin, just a quick message from our sponsor, Grow Solutions, where health and wellness professionals discover how to double their impact and income without doubling their workload. Grow Solutions eliminates big headaches in the practice, whether it's generating new patients or clients for you, maybe patient communication systems that we set up for you. If there's chaos in the practice, we help you implement proven systems and frameworks. And yes, we implement AI systems and agents that allows you to enjoy practice and life again. So Grow Solutions is not an agency or a vendor. We are your growth partner. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow in below, or feel free to reach out to me on any social platforms. But you're here for a reason today, and that is to meet our guest. I am pleased to introduce you to Dr. Lauren Mitchell, a board-certified family medicine physician and founder of Honest Family Medicine. Can you find a better name than that for a practice? I don't think so. I love it. She's a direct primary care clinic that focuses on whole family health care with a holistic approach. With over 12 years of experience in a broad range of medical care, to include military medicine, family medicine, urgent care medicine, hospice care, and functional medicine, Dr. Mitchell has helped thousands of patients find their wellness by teaching them to pay attention to their bodies, advocating for their needs, and restoring their hormone, gut, and mental health using both functional medicine and conventional medicine approaches. Dr. Mitchell is known to her patients as being the first doctor that actually listens to what they have to say. That's a wonderful compliment. Takes a lot of pride in addressing the patient as a whole and incorporating as many aspects of their lives into their care as possible. She is actively involved in independent physician groups and direct primary care movement in her area and nationally, and serves as a mentor to both students and medical professions alike. Dr. Mitchell, welcome to the Prime Health Podcast.
Thank you so much for having me today.
Absolutely. I'm excited. And again, the name of your practice, you just can't beat Honest Family Medicine.
Thank you.
You're welcome.
Thank you.
So I always ask this question at the start. Was there a moment in time, a situation that took place in your life, or that you just said, you know what, I want a career in medicine?
Yes, there was definitely a very specific time in my life where I thought, I think this is what I'm supposed to do. And what's funny is I actually started college and applied for a scholarship when I was a senior in high school to be pre-med. Changed my mind about 8 times along the way and graduated as pre-law. And And then I just didn't know at 22 what I wanted to do with my life. So I actually on the same day applied for the Navy and the Peace Corps. And I thought, as any 22-year-old has the benefit of doing, I just thought impulsively, whoever calls me first, that's what I'm going to do. And the Peace Corps called me first. So I ended up serving in a very small village in the country of Kazakhstan. And I was actually an English teacher and did a lot of public health outreach there. But it was actually a friend of mine, a local Kazakh gentleman who inspired me to go into medicine. And it was actually Christmas Eve. And there was a group of us walking around the town looking at the lights and just talking and enjoying the snow. And he had asthma, and access to healthcare is very limited in rural Kazakhstan. And there's also a very cultural belief that if you have an illness, it's considered a weakness, especially in a man. So he not only had never had an inhaler before, but there are no Walgreens in the middle of Kazakhstan. And so what they do there is individuals basically have a pharmacy in their garage. And so we were driving around. He was getting worse and worse with his breathing and his wheezing. driving around trying to find someone that was open that might have an inhaler. And eventually he really got worse and worse to the point where he was unconscious. And it was terrifying. But I had been a lifeguard when I was in high school and the first couple of years of college. And so I started doing CPR on him, doing rescue breaths. I never once in my life thought I would actually need that in real life. And we finally got to a hospital where there is no ER. So the others got out of the car and they're banging on the door, trying to just wake up a nurse or a security guard or something. And in the meantime, I'm just straddling him in the front seat of the car doing CPR and just trying to revive him. Thankfully, he was taken in. They gave him necessary medications and he did survive that. Unfortunately, he did die a couple years later from the same thing. But at that time, I thought, holy cow, that was insane. And I just really felt, if you don't mind me saying, like God was talking to me like, yep, this is it. This is your job. And so when I got back to America after doing 2 years in Kazakhstan, I right away went back to school and did all of the science classes and the physics and all of the courses I literally avoided as much as possible as an undergrad, and began the process to apply to medical school.
Wow. I will say that is probably one of the most unique stories in which that started.
Yeah, it was the craziest 2 hours of my life, just about. Definitely at that time.
Yeah. And I will say this, no problem spreading the message of God on here. It's worth it to do it. Hopefully there are more people who will get involved as we go along that. I do want to ask a question because you did say at the start or in the introduction that you were involved with some military medicine. What does that mean? You dive into that a little further.
Yeah, sure. I'd love to. So I was very lucky enough. I feel so blessed that just things have come to me, information has come to me right when I needed it. And I think to me, that's a sign that I'm doing what I'm supposed to be doing. And my mother, when I was in the process of applying to medical school, my mother happened to be on a flight to Florida next to an Air Force doctor. And he told her all about a scholarship program where they will pay for your medical school and then you pay back time in the military because they really need doctors. And she told me about it. I applied. I was lucky enough to get it. And so after I finished medical school, during medical school, I went to like commissioned officer training in the summer sessions. And then after medical school, I did 3 years of my family medicine residency in a military hospital in California. And then I did 4 more years payback as active duty after that. So I was 7 years active duty altogether.
Wow. Well, thank you very much for serving our country in a very unique way. That's amazing.
Thank you.
Yeah. So that is that's a very interesting path. So once you were done there, did you still stay in family practice or like how did you advance away from the military?
Yeah, so initially I thought I was going to retire out. I thought I was going to stay in and try to get my full bird, meaning a colonel, and do at least 20 years in. And then unfortunately, family circumstances changed where I needed to get out and separate and move back to my hometown, which I never thought I would ever do in order to take care of my mom. And so I decided at that time I'd also had a premature baby. COVID was just starting, and I said, okay, I think it's time to make a change. So we moved back home, and I knew I wanted a job to give me some flexibility and more shift work. And so that's when I took a job in the urgent care. So I would have plenty of time with my baby, plenty of time to help take care of my mom. And that was the craziest job I've ever had, working at an urgent care in the middle of the pandemic. I was seeing over 100 patients a day sometimes.
Oh my.
Yeah.
Wow. Well,
so
yeah, your preemie baby, everything okay with the preemie?
He's wonderful. He's 6 and the most intelligent, sassy little kid you could ever meet. Thank you for asking, though.
We had our own little preemie, 3 pounds, 5 ounces at 31 weeks. So they're all a little special place in the heart for us.
Yeah.
So then you were working in urgent care, and then did you then decide, okay, I'm going to start my own DPC? And if that's the case, I want to ask you if you'll explain to people what does DPC.
Sure. Yeah, sure. Well, so I had incidentally, again, just luck and exposure to things where, I believe that manifestation is attention with intention, right? And so I happened to hear about direct primary care from an accountant, actually, and he gave me his doctor's phone number. And I said, "What? You have your doctor's phone number? What is this?"
Yeah.
And he said, "Yeah, call him. He'll tell you all about it." And that's how I ended up hearing about direct primary care.
Okay.
And direct primary care is essentially how medicine used to be long before kind of big pharma and all of these CEOs and big hospital systems took over, where it's the relationship between the focus of everything is the relationship between the doctor and the patient. And in order to do that, we spend way less time doing paperwork because we don't bill insurance. And instead, we get to spend as much time as our patients need with them, getting to truly know them, fully understand what's going on with them, and having enough time to come up with a really good care plan and teaching of our patients. And so what direct primary care is in its purest form is the patients will pay a membership fee every month. And typically that means unlimited visits. You text your doctor or you call them directly if there's something that you need. And it's in the interest of just taking away as many barriers as possible and bringing back that trusting, caring relationship between doctor and the patient.
Yeah. Thank you for sharing that. I remember when I was little, I am 55, and I remember it was called the bone clinic. And when we had a problem, we could call to speak to the doctor or the nurse, and you could get through.
Right.
Of course, life is advanced, but it's from my learning knowledge of what DPCs are, it's an amazing aspect for people to learn. And having Honest Family Medicine is the name of your DPC. Again,
Yes.
I love how that took place. So
Thank you.
Yeah, you bet. So some people that may not understand DPC yet, what is the true difference of if they were to see you in a clinical setting at a hospital versus the clinical setting at your practice?
Yes, so there's actually a lot of difference. First, how do you make an appointment? Well, nowadays, thankfully, a lot of patients can actually book their own appointments online, but I've been doing that since the beginning.
Okay.
Second of all, when it's a hospital-based system, you're competing with somewhere between 2,000 and 5,000 patients just to get an appointment. And then when you finally show up, maybe you're in the waiting room for an hour, hour and a half, just to get maybe 5-10 minutes face-to-face with your doctor. And then when you're in there with your doctor, it seems like they're just looking at their computer the whole time because they're in a rush to get all of this paperwork done. And there really never seems to be a true connection or enough time to take care of all of the things that you need. In direct primary care, if I have a patient that has a lot of concerns or a complicated medical history, if I say, "Oh, Miss Smith is coming in today, let's give her an hour and a half," I have the power to do that. And that is not something that's capable for the doctors that work in the hospital systems. They're told how many patients they have to see a day and how short their appointments are. The other big difference is, and please believe me when I say that if you've seen one DPC clinic, you've seen one DPC clinic. They're all a little bit different, but the model, the payment model, and the emphasis on relationships is the same. But the other big difference is that when your doctor, who is fully trained family medicine, we are trained to do so much more than you've probably ever seen in a hospital system. It's just that your doctor doesn't have time to do it. So it's very common for me in a given day to do a well woman exam, 2 well child visits, do a skin biopsy, do a full skin exam. I mean, really, we do some stitches, give some IV fluids, a lot of urgent care, dermatology, family medicine, mental health. Those are all things that we're all trained in. But over time, when you're not given enough time to do that in the hospital-based systems, you lose that ability. And the hospital systems really reinforce that those primary care doctors should just refer out to the specialist. And that loses traction and trust and continuity between the patient and the doctor. And that is something that all along the way I knew that I wanted to maintain the skills that my military medical residency taught me.
Mm-hmm. I love how you explain that. There's too many people that don't understand what you go to school for. And
Right.
You're exactly right, Dr. Mitchell, in the fact that you can't address a patient's concerns in 15 minutes or typically 7 minutes. And that's the time crunch the doctors are in the hospital. They're not bad at
Right.
what they do. He or she is wonderful at what they do, but there are limitations. The knock on the door is really about them saying, hey, get going into the next room. And that's very hard. And the way you have time to spend with your patients is critical. They get to listen. You had said that you're the only doctor people have said that finally listens to me. And by listening
Right.
to someone, you truly get to hear what's wrong with them.
Correct. And in fact, current medical care system, and I want to be really clear, I am not dogging on the doctors that work in these systems. They're stuck, and most of them are just as miserable as the patients are, to be honest.
Mm-hmm.
But in the current medical system, we there's just not time. There's 5-10 minutes, and it actually is the exact opposite of what we're taught in medical school. In medical school, we're taught if you listen long enough, the patient is going to tell you what's wrong. Then you do an exam and maybe order some tests to confirm it. And there's no way to be able to do that when the first half of the visit's vital signs and filling out ridiculous questionnaires that you filled out last time.
Yeah.
And so it really ends up being a waste of patients' time, a waste of their money. It leads to a lot of frustration and, like I said before, a loss of the relationship. Where I have always bought into the tenet of if you listen long enough, the patient's going to give you clues about what's going on. And I think it's really unfortunate in a lot of the hospital-based systems that there's never that opportunity for that.
Yeah, great points, and all valid as well. I know we're not, having anything slighted against a doctor in a hospital setting.
No,
You need to be there
no,
too.
no.
Patients don't know the difference. More people need to experience how you practice medicine, which is important. So in
Yep.
2022, you started your own practice. And then
Yes.
when you did that, was there something that changed a little bit for you starting to add functional medicine into your practice?
Yes, so there was always a desire to have a deeper understanding of what was going on with the patient, even beyond what I was taught in my medical training. I didn't know at the time that that was what functional medicine was, but I started noticing pretty early on in my training, like, why is it that these patients always seem to have this problem as well? And I didn't know where to turn or how to look into it. And actually, I started doing a little bit of learning into functional medicine before I opened my own practice, but I've been lucky enough to have patients that are very interested in finding alternative solutions and they're very open-minded. And I try to be open-minded as well. And so a lot of times it's my patients that teach me. And I think, oh, that's interesting. Send me that article. And so a lot of times they're the catalyst of, at least in the beginning, of what I needed to look into and how I could learn more until I eventually joined an official program.
Okay. So just so people understand as well, going to your practice, your family medicine, are you a DO? Is that correct?
I am. I'm a DO. Uh-huh.
Doctor of osteopathic medicine. So
Yeah.
they can get treated by you the same exact way in a hospital setting, but you listen more, you care
Yes.
more. We want to be, quote unquote, everybody cares, but you care more because of the time you take for that. But then you'll also look at functional medicine. So the functional medicine side is really finding ways to help them heal themselves, not always with medicine.
Correct. It also involves digging a little bit deeper into the cause of why. If you asked my mother, she would tell you, I was that kid that was always like, yeah, but why? Yeah, but
Yeah.
why? Kind of like that snowman on that movie Frozen, or was it Olaf? He's like, yeah, but why? Yeah, but
Yeah.
why? So I was always like that as a kid, and I always felt like there's got to be a little bit more to this. And so functional medicine, besides the treatment modalities and lifestyle medicine that's involved with it, it also kind of starts even before that with digging deeper using specialized tests into the underlying reason, whether it's trauma, allergies, mold exposure, hormone imbalance, gut imbalance. I mean, there's so many possibilities of the underlying cause of someone not feeling well that we are never exposed to in traditional medical school.
You're still very young into your own personal practice, but being in there, have you noticed a rise in people looking for functional medicine services?
Oh, yes. Oh,
Yeah.
yes. And this has come, in 2025, we don't live in an era anymore where, the doctor said this, so I'm going to do it. That's not reality anymore. And I sort of feel bad for doctors that haven't realized that because they're losing the trust of their patients. We live in a society now where someone can just go to TikTok and look up their symptoms or follow a nutritional specialist or a self-proclaimed hormone guru, and they can find the answers that they think is right at the tip of their fingers. I mean, using their phone. And so this is something that's really important to me, is that patients know that there's a big difference between doing a weekend course in functional medicine versus spending years and years doing that. But at the end of the day, as long as it's an alternative way to look at things, it's being safe, you feel like you are being heard, there's some patient autonomy as well as patient responsibility involved, and we're being safe. I'm really excited that these new horizons and outside the box thinkers are now on the scene. And anyone can, there are a lot of different professions that can do functional medicine, from a nutritionist or dietitian to a nurse practitioner, chiropractor, physician, and all of them come from different backgrounds, but the goal is to come to the same conclusion if we're doing it right.
Yeah. Yeah, I appreciate you sharing how all the different professions can get involved, and everybody is unique. As you say, they bring their own background in, so they have a different twist in the way a nurse practitioner may treat somebody that comes in with certain signs or symptoms may be a little bit different or unique to you. But the bottom line, you had said it earlier, is when you sit there, and I was told this by my accountant, when you sit there knee to knee and, press the flesh with one another and, put your hand on them and say, well, tell me a little bit more, always asking that next question. That's what differentiates most physicians is, can they take the time? And when they take the time, do they really want to listen to what's being told?
Yes, I think that we all start off that way, and then depending on what setting you work in, there are some doctors where that, unfortunately, that internal clock is going, where it's like, oh, my next patient's waiting, and if I want to get home to dinner one day this week, I need to keep moving on. But I think all of us start that way. Every doctor I know that went to medical school started very idealistic and really wanting to help people. And then it's sort of burned out of us throughout our training.
Yeah. It's unfortunate. The burnout factor, the depression factor, the suicide factor, all of that stuff is on a rise. And I think that the way you run a direct primary care practice maybe, alleviates some of that. Doesn't mean that you don't have stress in your day by any means, but eliminates some of it.
Percent. And actually, I think that if any physicians or anyone that knows a physician ends up listening to this, it's really important that they know that these are groups. Like, I came up with a group of physicians, and I'm here today because they helped me. They helped me understand what direct primary care was, how to set up my own practice. And this is not a competitive type of clinic setting. And there are DPC clinics opening up all over the country, more now than ever. And there's a high interest in it. And we all really do help advise and mentor each other. And so this is an escape route for people that want to continue to be a doctor, but are burned out and tired, and they want to have some control over their own schedule and how they practice medicine.
Yeah. That's good that you say that. Everybody does need a little helping hand up, especially if you've been helped before. So from your practice itself, Honest Family Medicine, what's the focus right now in your business?
Right now, I'm working on expanding my staff because I have a pretty large wait list. And I'm trying to find like-minded or interested in medical professionals that are not locked into a contract or a non-compete that come and join me. And so that's where we are now. And then hopefully in the next couple of years to have a couple of other locations. That way more patients can be served, and I can hopefully bring on some more physicians with me and show them a better way to practice as far as lifestyle and life balance, and kind of let them, hitch a ride on my wagon, if you will, because I'm happy. Not everyone wants to open their own practice. Not everyone wants to be a business owner, but there are a lot of doctors that are looking for a new space to practice and a little bit of a breathing room in their medical career. And so I'm always open to bringing on new docs, because the patients are there, the patients are waiting, they want to be seen, and they really crave it. And so right now, the biggest limiting factor in my growth is finding qualified doctors that aren't locked into contracts.
Yeah. Are you close to a big hospital system?
Yes, well, we're right outside the St. Louis area, and there's many hospital systems. So the non-competes have been a real problem, and they really lock those doctors into contracts, and it's pretty hard to get out of them.
Yeah. That's unfortunate. They're not looking at it for the patient perspective on that when they're putting a non-compete in for sure. It's really about the
Right.
corporate component of it. How about from a technology standpoint? Has AI made any changes in your practice?
I do. I have recently started using some AI capabilities, and for a long time, I was slightly a conspiracy theorist about like who's listening to what and things like that, but I have found a couple of tools that help me stay as detail oriented as I want to be and help me spend less time doing my own charting. So I do use like a AI transcriber that helps make transcripts of the visit, so I can go back and take a look and remember exactly what they said when their symptoms started, for example, and it helps me stay as detail oriented as I like to be. So I do use an AI transcription service, and then it's well known and it does a great job. And then occasionally I'll use some AI tools to help with some social media things. I'm not super great at social media. You might list them all out later, but you'll see it's a little stale. But I do use that for that, as well as sometimes if you know how to be judicious about what you're reading, you can use AI to aggregate a lot of different research material at the same time. I think it's important that you know how to kind of read through the lines and know what's a good study versus a bad study. That should be always at the forefront and be a priority. But you can use AI for resources and learning, this is not, I didn't learn this in med school, so what do I do now? And that's been a really good resource as well.
Good. Well, I'm glad you stepped into that risky zone, and hopefully you're finding out it's not too bad. It's helpful for
It's
people. It allows you to
it's
still
not
have
too bad.
yeah.
Right.
When it comes to honest family medicine, can you share a success story of somebody coming in and achieving better health from when they first entered?
Gosh, yes. I would say that, where do I start? And I don't mean that to be arrogant. I have so many patients that I have such close relationships and I've seen them thrive. And I would say one is a mom of five in her late 40s, really just not herself. Everything about her life is changing, definitely in that perimenopausal period, but also a really significant family history of estrogen related cancers and blood clots and just a lot of fear involved with balancing some hormones. And it got to the point where actually she was about to get a divorce. Her kids didn't want to be by her. There was a lot of shame, like, why did I react that way? And I was able to teach her and check at a much deeper level her hormone levels and teach her how we can balance them both in natural methods as well as like through diet and some supplements, as well as using some hormone replacement therapy, bioidentical of course. And I mean, within 2-3 months, she was a completely different person. Her marriage got back on track. Her relationship with her kids is probably closer than ever. And it's just such a joy to see people come in and follow up. And you can just see in their energy that they just feel so much better and they have a bounce in their step. And that's something that really brings me joy on a daily basis.
Yeah. I did another podcast earlier today and I asked that question and it was not identical, but so close to that. A woman,
Yeah.
mid-ish, husband issues, kid issues, and then it changed everything. And like I said in the other one, the beauty of how you helped this woman is it helped her first and foremost, but it built the family relationship. It now allows her to be able to model her children to say, look what mommy did to change. She then is a better mentor leader in her family because of what you did for her. So I commend you.
Thank you.
Yeah, you're welcome. You don't get thanked enough in this profession. You don't get thanked enough, that's for sure.
Thank you.
So, yeah. What do you feel, Dr. Mitchell, that you do better than anybody else in your community when it comes to healthcare?
Gosh, other than spending,
On people, we're just saying, what is it that you do best?
I think it's really taking my time. So I'm in family medicine. I don't work in the ER. I have the luxury of being able to take a few days and research and really problem solve in my mind. So I would say taking my time when listening to the patients, and I have the luxury of being in control over my own schedule. So maybe I can call them the next day, follow up with a few more questions, and really just think really hard about where do we go first and how can I figure that out? And just the problem solving aspect. I think also most people would say I'd give you the shirt off my back, not literally, but I really do love my patients, and I love having a relationship with them. And I think that's something that I've really prioritized in my practice. And so when they invite me to a birthday party, if I can go, I go. Unfortunately, there's been a few funerals, so I'm always there. There's weddings, I'm always there. And I really, really work hard to make sure that people know that this isn't just an office you come and go from every 6 to 12 weeks. Like, this is a community. The buy-in from that really pays back in spades because the patients know, no, I'm here for you. I really care.
Yeah, yeah. I love to hear that. It's a wonderful thing because you are truly a community member. You're a physician in the community, but you're a community member. And I'm sure they all love and appreciate you for that. Now, we'll take all of the links that you have. We're going to share them with everybody. We want to make sure that they can get a hold of you. But if somebody's listening to this and they're like, I'm interested in learning more about Dr. Mitchell, I'm interested in learning more about her practice, how would you suggest people reach out to you?
So I would just go to my website, www.honestfamilymed.com, and just click on the contact us link and just shoot me a message. Whether you're a doctor looking for a way to open up a practice like mine, or you need some advice on doing that, or you're a patient looking for a practice like mine in your area, or just general questions, I'm always checking that inbox regularly. And so that's a good way to go.
Okay, love it. And you also do a little bit of consultation with other primary care physicians that are looking at what DPC could offer them.
Correct, yes. And this is not any kind of side gig or business of mine, but the direct primary care community of doctors is very close and very well connected. And we get together in smaller groups, like in the St. Louis area, as well as for national conferences. And someone says, can I call you sometime? I'm like, yes. And so I give out my number left and right. And I think it's really important that they have someone they trust or at least maybe trust that can help them figure out the path to open up their own practice, instead of some of these businesses that are a little bit predatory and want to take a piece of the finances away from them, or sell them some expensive equipment that they don't need. It doesn't have to be that fancy at the beginning. And so I love fielding questions from doctors who are interested in opening their own practice. And a rising tide floats all boats, right? And so that's definitely a universal sentiment throughout the direct primary care doctor community.
Love it. Thanks for doing that for the community. It's wonderful that you
Yes.
can, and benefit for those that are out there. So I've got two last questions for you. If you could give one piece of advice that would advance somebody in a positive way in their health, what would that advice be?
That's actually a really easy question. Put down your phone, turn off the TV, get away from your computer, and go outside. Please, especially in the morning, get that vitamin D going and that cortisol going with that sunlight in the back of your eye. Start your day off right. But even if you can't do it in the morning or the weather is not great, please spend some time outside, 30 minutes at least every day. It does so many positive benefits for your mind, your mental health, your bones, your brain, your hormones. Everything gets so much better when you're away from the screen and outside in the daytime.
Exceptional advice in so many ways, for sure. Absolutely. So, Dr. Mitchell, the last question I ask is, you're on the Prime Health podcast. What is your definition of Prime Health?
I think that's a very individualized type of definition of what prime health is. But in general, I would say that If you have a goal in your life or a mission in your life, whether it's to spend time with your grandchildren or to finish a marathon just once in your whole life, that you have the tools and the health to be able to do that goal. So there's a lot of different ways you can do that, from diet changes, exercise regimens, and all of that. But prime health means that you are well enough to meet your big goals in life.
Thank you. Every time I ask the question, I get such a unique response because it is individualized. Yeah. So I appreciate you sharing that with me. Very, very well put. So thank you on that.
Thank you.
And Dr. Mitchell, thank you very much for being a guest here on the podcast. You've got some incredible insights from being in the Peace Corps, having that amazing experience and saving that gentleman's life, which is great. Then having your own advancement and adventure into how you found medicine to go along with that. And then eventually opening your own practice where you're making a true impact in your community. So I always tell people we love to have the podcast shared from a business perspective. But the truth is, we want you to share this to somebody in your community. It doesn't have to be in St. Louis. It's somebody that could benefit from what Dr. Mitchell had to say, whether it's a friend, family member, or somebody, whether it's a business owner that you know that's looking for their own practice and want to ask some questions, please share it, because the more people, as she said, the more we can help, the better it's going to be all along around there. So I'll be selfish, of course. Please, subscribe to our Prime Health podcast, share that around as well. But until next time, as I always say, remember that we are on a true wellness journey and we're all on this together. Now, whether you're in charge of your own health or guiding others in theirs, every step forward matters. So I just ask you, stay committed to your Prime Health journey. And again, Dr. Mitchell, thank you so very much for being a guest on the Prime Health podcast.
Thank you very much for having me. This has been a great time.